Welcome back, everyone. We're going to finish out the neurology series by taking a look at neurologic, infectious diseases, and cranial nerve disorders. We'll start with cranial nerve disorders, and the importance of understanding some of the cranial nerve disorders is that they can mimic other disease. Most commonly, things like Bell's palsy can mimic stroke symptoms, and it's important that we obtain a thorough history with these patients to help rule out specific causes of diseases. The cranial nerves, as seen here on the screen, are arranged in pairs. You have one nerve for each the left and the right hemisphere and corresponding part of the body, and they're named and numbered based on their position where they exit the base of the brain. So, for example, the olfactory nerve is cranial nerve number 1. The accessory nerve is cranial nerve number 11. The hypoglossal is 12. And another common nerve that you'll hear is the vagus nerve, which is cranial nerve number 10. Most of these cranial nerves do innervate the facial region, and so when we see cranial nerve disorders, they will most commonly exhibit symptoms within the face and the head. A thorough neurologic assessment can help identify deficiencies in cranial nerves. One of the things you can do is ask about vertigo or test for vertigo. Have the patient lie supine and then move the head sort of rapidly left to right. And then look at the patient's eyes to see if the eyes are following the motion or remaining in a position of stasis. If the patient has vertigo, nystagmus will be seen. So that's the delay or the tremors while you're moving the head left or right in the eye movement. And complications of vertigo can include things like nausea and vomiting and headaches. Facial nerve palsies are another common cranial nerve disorder. Most commonly is Bell's palsy, which is a disease state that can impact the facial structure, and it can cause the face to droop, much like the patient is having a stroke. Unlike strokes, there are no other concomitant presentations, signs or symptoms of a stroke present, and so the patient may be fully upright, walking, talking, have perfect coordination, balance, and vital signs be all stable, but their trigeminal nerve or one of the other cranial nerves may be in a state of disorder, which makes the patient appear droopy on one side of the face. Again, things with cranial nerve disorders are important in helping rule out underlying causes of diseases. And as far as symptomatic presentation, things like nausea can be induced with vertigo and other cranial nerve disorders. And so advanced level providers may need to provide treatment for nausea via promethazine or ondansetron. Dystonia is a severe muscle spasms that can cause severe and bizarre contortions or repetitive motions and postures. The reason for this is relatively unknown, but it can be extremely painful and panic-inducing in the patient. Cervical dystonia is the most common form of focal dystonia, and it's characterized by intermittent and repetitive spasmodic motion of the head in sort of a twisting or extending and flexion pattern. You also have oliguric crisis and several others that you can see here in the chart on your screen. Treatment is revolving around pain management for these patients, and so advanced level providers will be able to administer various pain medications that may be able to help. Basic level providers would be supportive care and communication and try and help calm the patient through these states. Focus on ruling out other problems and make sure that you're calm and reassuring with these patients. This can be extremely painful for the patient and extremely terrifying. Okay, let's talk about some of the CNS or central nervous system infections. So one is encephalitis. This is an inflammation specifically of the brain. Then we also can see things like meningitis, which is an inflammation of the meninges. Damage in these infectious diseases are predominantly caused by the body's reaction to the infection, so high fever, headache, nausea, vomiting, the inability to eat, those pieces. Although some of them are extremely contagious and infectious disease precautions need to be taken, and we'll discuss those here in a moment. The most common presentation for CNS infection is going to be a fever. If the temperature becomes too high, the patient can become delusional and can experience loss of consciousness. Particularly in child patients or pediatric patients, we see the risk of febrile seizures, which we discussed in the fever lecture, and that has to do with the rapid change and fluctuations in body temperature, and the body really can't compute or adapt to those changes, and so seizures will become present. As far as assessment for meningitis, we can use assessments like Kernick sign, Brodzinski sign, and this is where we can take the leg and flex the leg upward, and then bend the knees and flex the head upwards, and this will typically elicit a painful response, or in a compensatory mechanism, if we move the head upwards, the knees will often come up to the chest as a response mechanism. If meningitis is suspected, droplet precaution control and infection control becomes really important. You should mask the patient, mask yourself, make sure that you advise the receiving facility that you have the potential that you're transporting a meningitis patient, so we can help prevent the spread of that. Be prepared for things like seizures and septicemia, as well as a risk for increased intracranial pressures in meningitis patients. Paramedic, EMT, EMS providers as a whole, in fact, the healthcare spectrum as a whole, we have to try and make sure that we do our best to disrupt the contagion pathway. So breaking the chain of the infection is one way to look at that. We want to make sure that we're taking appropriate droplet precautions and isolation for these patients so that we prevent the spread of the disease to other patients. Neural abscesses, it's caused by an infectious agent within the brain or the spinal cord, and it's usually as a result from the immune system being unable to kill the pathogen, and it erects a wall or a barrier of tissue that keeps the spreading from occurring. This abscess is often preceded by an infection of things like the sinuses, the throat, gums, or the ear. The main consequences are damage to the brain and spinal cord over time. Look for things like a low to high-grade fever, persistent headache. This can be a presentation associated with generalized or focal seizures, nausea, vomiting, and then focal motor or sensory impairments as well. Standard patient care for these, supporting vital signs as needed. Pay attention if there are signs of increased intracranial pressure. One of the terms that should be coming familiar is this increased ICP. We can look for things like Cushing's triad, that increase in blood pressure, the reduced heart rate, and the irregular respiratory pattern. We also want to evaluate temperature for these patients and be prepared for seizure activities. Poliomyelitis and post-polio syndrome is viral infections transmitted by the fecal-oral route. This was common in the United States. It was commonly contracted by those in the United States for those that haven't been vaccinated or immunized against the disease. And there's been no wild originating cases since about 1979. Assessment for these patients include things like sore throat, nausea, vomiting, stiff neck, muscle weakness, and paralysis. Supportive care in the pre-hospital world is kind of where we'll live with these patients. In-hospital care will be directed at hydration, ventilation, and caloric support to make sure that the patients are maintaining an adequate nutrient status. Patients are at risk for problems even up to decades after infection. They can present with muscle fatigue and breathing conditions. For those progressive patients, we'll be concerned with airway management, to making sure that the patients are able to either maintain their own airway or ensuring that we have the interventions appropriate to maintain that airway. Peripheral neuropathy is where the nerves that lead the spinal cord are damaged. Causes can include things like toxins, autoimmune disorders, metabolic disorders, or trauma. Signs and symptoms for peripheral neuropathy include sensory and motor impairment, pain, tingling sensation. A term for that is paresthesia, that pins and needles sensation in the hands and feet. It can be accompanied with muscle weakness and burning sensations as well. Largely supportive care for the pre-hospital setting for these patients, and in-hospital treatment will be aimed at controlling glucose levels and managing the patient's pain.